Hello, I'm Teresa Simpson, Healthcare and Life Sciences Co-Lead at Mazars, and today I'm sitting down with Nigel Layton to talk about the regulatory and compliance environment in the sector. Hi Nigel, how are you?
Hi, very well, thank you. Looking forward to this.
Yes, absolutely. So the regulatory environment has heightened recently. What's going on?
There's a lot going on, particularly in the new areas of modern slavery, for instance, where the pressure to manufacture properly within guidelines, within legal boundaries is huge. The pressure not to use child labour and the reputational issues for getting it wrong in the sector are huge. And as life sciences pharma companies have to manufacture in different countries of the world, they have to be prepared to really take notice of modern slavery legislation. Also, ESG is right on the forefront of everything. Every big pharma life sciences company has got ESG targets. They are becoming regulatory, they're getting audited on them, and very important areas too. Patient data, confidential information, protection of information protection is huge, again, area, and again, data must be kept confidential or reputational issues arise as well. But the area I'd like to focus on today is anti-bribery and corruption, where the industry has suffered huge fines over the years, and it's still a really big issue for life sciences pharma companies around the world.
So let's do that, Nigel. On anti-bribery and corruption, what are the issues that companies are facing at the moment?
I think the issues companies are facing are huge. The regulator is becoming more active again after the lapse during COVID. There are more and more prosecutions. Since 2011, there have been 23 major investigations in the US and the UK, 23 prosecutions, and $1.75 billion worth of fines in the industry. These give huge reputational issues, huge cost, and really are an unwanted distraction. So the regulatory environment is huge. The prosecutions are still creeping up and big cases. Life sciences is second only to oil and gas in anti-bribery corruption risk.
So why are bribery and corruption risks so high in healthcare and life sciences companies?
I think it's due to the fact that they sell to governments around the world. So drugs are sold to all countries around the world, in all continents, in high risk and low risk jurisdictions. And the sales to government entities are really ripe for bribery and corruption. The incentives given by certain governments around the world are huge. The temptation to give bribes is really significant. And the areas such as drug approval, product manufacture licenses, and the sales of products to hospitals are really areas where key bribes are offered and have been offered in the past and really must be looked at.
So Nigel, why should companies think about this now?
Well, I think the regulators are taking a keener interest now in bribery and corruption than they have for a number of years. Interestingly, the regulators are taking on and employing compliance professionals who really understand the compliance systems and processes that companies should have in place. And these are key processes for the regulatory environment and are mentioned in the laws that you have to have these. So they are taking a keener interest, they're understanding it better, and they're looking at compliance much more closely and in a more informed way. And I think also the whistleblower complaints are on the rise as well, which means that they have to take these seriously, they have to really investigate them thoroughly, because whistleblowers have certain protections, and it's now a common way of raising a concern, and concerns must be treated seriously. And finally, there's been an increase in deferred prosecution agreements, DPAs, which mean that actually the company can enter into a confidential arrangement with the regulator, which means there's less adverse publicity and less reputational risk if they reach agreement on a fine or a charge.
So Nigel, there's a lot to understand there and a lot to consider. So what would be your key takeaways for businesses?
I think key takeaways are look at your compliance programs, make sure they are bulletproof in today's world and really robust and have moved with the times. Don't sit there with a compliance program 10 years old and think that was fine. It won't be fine today. Look at your whistleblowing programs as well. Make sure you've got robust programs for dealing with whistleblower complaints. Look also at your third-party due diligence. Absolutely key part of bribery legislation is to do third-party due diligence on your distributors, your agents, your marketing agencies, any agency that deals with governments. You really have to do some thorough due diligence.
So Nigel, that's been really interesting and lots to take away there. What would be your top 3 tips for life science and pharma companies?
They should revisit their compliance programs, and that's vital with the employment of compliance personnel in the regulators. They should really do training of third parties, of distributors, of their salespeople to make absolutely sure that they are trained in anti-bribery and corruption, and they should do their third-party due diligence on their agents, distributors and other third parties as required by the Act.
Well, thank you very much, Nigel.
Thank you, enjoyed that.
Speaking with you.
Thank you.